Hi, everyone. I'm Dr. Richard DiCenso. Welcome to this first in a series of every other week summer videos detailing our adventure in the world beyond medicine as we explore a new way of thinking. So thank you so much for joining me today. And I hope that you'll be able to join me every other week as we explore this world beyond medicine. But before we begin, a couple of house cleaning items. Number one is I want to be sure, because we have a storm rolling in here, I want to be sure that you've got clear audio and video. So if you'd be kind enough during the course of this presentation to hit the like button, hit the heart button, hit the wow button, just let me know that you're getting the information that I've prepared for you. And also, I want to let you know in advance that if there's anything that you do want to know, any details that you'd like me to be able to provide for you, any comments you have, any requests that you have, by all means, please share them during the course of this live presentation. And if I don't get to them today, don't be offended. I will respond to them either in an email, and you can submit an email subsequently at drd.matrix@gmail.com. Or I will use them as a foundation for the foundation in future audios, or videos rather, to detail a response depending on the nature of the question that you ask. Now, before we get into the material today, perhaps a little background information is required, essential, necessary for us to have this discussion. So as many of you may already know, I'm known as, to most of my patients, as Dr. D. And currently, and for the last 40 years, I've been CEO of Matrix Transformation, the creator and developer of an innovative evaluation process known as the Matrix Assessment Profile. The acronym is MAP, and the acronym has some very specific implications, one of which is kind of obvious. If you want to get from where you are to where you want to go, a map can be pretty handy. But also, it indicates the foundation, or suggests the foundation upon which a lot of the structural foundation for the Matrix Assessment Profile is built. And that was based upon a statement that was attributed to Hippocrates when he said to many of his first-year medical students, it really doesn't matter what the symptoms are. It doesn't matter what the disorder is, what the dysfunction is, what the diagnosis is. It matters far more who the person is that's experiencing these symptoms, these dysfunctions, these disorders, these compromises. And so with this not yet being a part of the foundation to which I actively subscribed, early in my career, I had a number of credentials, a lot of letters behind my name, which really didn't serve me well in terms of being able to identify the cause of symptoms or turn symptoms into solutions. They simply gave me a legitimate and a legal format for evaluating the concerns that people had. And having worked now for close to 40 years with tens of thousands of people all over the world, I've refined and hopefully perfected this evaluation process that I'm going to share details about during the course of this and subsequent videos. Now, everything that you're about to hear is also consolidated into my book, Beyond Medicine, Exploring a New Way of Thinking. So I'm also going to share with you a little later on how you can acquire a special copy of Beyond Medicine designated specifically for attendees in this and other videos that I produce, but also how you can acquire more information about what it is that I'm talking about today by simply going to our website at mymatrixmap.com, all lowercase, all one word, mymatrixmap.com. And virtually everything that you need to know about this entire process and everything you need to know about the details that I'm discussing in today's video are going to be present there, as well as a number of opportunities for you to get involved at whatever level you're comfortable. Now, in the meantime, early in my career, I was invited to participate in a very special and a very specifically designed hospital-based internship program at Cedars-Sinai Hospital in Beverly Hills, California. And the whole purpose of this particular internship was to evaluate the efficacy of alternative practices and strategies. And so the people involved that participated in this group were medical doctors who didn't practice medicine. They practiced things like homeopathy. There were dentists who didn't practice dentistry. They didn't work on teeth. They manipulated cranial bones. And then there were a host of other people in various subspecialties like color therapy, massage therapy, neuromuscular therapy, iridology, to acupuncture, to name a few. And the concept was, when somebody comes and has a particular group of symptoms, and those symptoms are evaluated according to the conventional standard of care, meaning that every discipline has its own belief system, has its own structural procedure in terms of evaluating symptoms. What if two people with the same symptoms, same age, same sex, same socioeconomic background, have the same symptoms? They're exposed to the same standard of care in terms of treatment alternatives. One of them gets results and the other one gets no results or gets worse. Why does that happen? Well, this was not only an incidental occurrence, this was a frequent occurrence throughout my entire career as an intern, and it provoked me to start asking questions. But in response to the questions I asked, which were basically, well, why is this happening? Most of the time, the answer I got, well, we really don't know. It's idiopathic, meaning that it's of unknown origin, meaning that we don't know. And so what's the solution? Well, the solution at that point, and unfortunately is still the point in a lot of cases, is that you need more education, you need more credentials, you need more experience. And so I took that early advice because I didn't really know what else to do. I wasn't aware of any of the other options at that point, except to pursue additional disciplines. And so I did. And so I acquired credentials in acupuncture. I acquired credentials in trauma rehabilitation. I invested in specialty training in a wide variety of areas, conventional and unconventional, things ranging from iridology and acupuncture to basic nutrition, but also advancing into the world of orthomolecular nutrition and ultimately into the world of forensics. But in every case, I came up against the same challenge. And that challenge was, this person's having symptoms. They've been everywhere. They've done everything. They've seen everyone. And they're still being told, we can't find anything wrong. We're going to have to wait and see. The symptoms are normal for your age. We're going to have to run more tests. Or the symptoms are all in your head. Well, obviously, the conventional model, regardless of the specialty, didn't accommodate anything beyond that particular specialty. So, for instance, if you had back pain, depending upon who you consulted, was going to determine what kind of advice and what kind of treatment you were going to be subjected to, for want of a better word. So if you had back pain, you went to a massage therapist, we're looking at muscles. You went to an orthopedic surgeon, we're looking at the spine. You went to a neurologist, we're looking at the nerves. You went to a chiropractor, we're looking at the vertebrae, and so on and so forth. But nonetheless, beyond the scope of that specialty, there were no real guidelines in terms of what do I do if the conventional standard of care within that specialty is ineffective or provides no substantial results. This is where I began to develop a series of what I call caveats, and ultimately led to the creation and the development of the matrix assessment profile, or the MAP. Now, obviously, the matrix assessment profile includes a quantum fluid analysis, an analysis of the biological fluids with some very sophisticated electrodes that give us information, basic information about the human biochemistry, the urine and the saliva, samples of which are acquired in the privacy of your own home and then shipped to our office, and where they're evaluated and then We've got built into the software what's called a predict blood feature, which simply means that based on what we see in the urine and the saliva, we're able to, a very accurate degree, predict what might be happening in the blood. And then with this basic information, we can acquire other information that helps us to detail what I'm about to experience or share with you in terms of why and where the probable cause is originated. Now, back to the caveats for a minute. My first goal and objective in pursuing a thought process beyond the conventional standard of care was to develop a format for determining what was causing the symptoms that an individual was experiencing that was not responding to conventional standards of care. So that first caveat was very important, but nonetheless frustrating, because it simply said anything can cause anything. Well, really wasn't helpful, but it was a great first step in becoming aware of the fact that maybe something outside of the specialty that I've been trained in, and maybe the advice I've been getting to acquire more education and more experience, had some validity at that point. But this still wasn't enough. Just knowing that anything could cause anything, how do you know what's causing what? Which led me to the second caveat or guideline in the process of developing this format for evaluating chronic and non-responsive symptoms. And that was based in the world of conventional physics, the Newtonian physics, that said for every action, there's an equal and opposite reaction. So now we know anything can cause anything. How do you know what's causing what? Superimpose Newtonian physics within that concept, and now you know that for every action there's an equal and opposite reaction. So what was the action that provoked the equal and opposite reaction? Well, what I subsequently learned was this just didn't hold water as this evaluation process known as the MAP began to unfold, because yes, there was a reaction, but it wasn't necessarily equal and opposite, as you'll see in a few moments when we investigate the three realms of influence that we're all subjected to on a day-to-day basis. Now, next, I was led to the understanding that because anything can cause anything, and for every action there is a reaction, everything works. Which means that everything that you take the time to investigate on your own, whether it's through your primary care, whether it's through investigation on the internet, whether it's through information that you receive from friends about something that worked for them, a device, a technique, a particular supplement, a lifestyle change, an exercise routine, all of these things have value. They all work. However, everything works most effectively when it's applied to a specific set of circumstances for which it's most indicating. First light bulb, meaning that I ultimately would have to pair the solution to the symptom, and in doing so, I would need to identify the cause. So where did that cause lie? Well, the next caveat basically says there are no panaceas, which means that no matter what the symptoms are, even if they're very common symptoms that express themselves within a conventional standard of care format, you cannot expect to apply the same solution to every person experiencing the same symptoms and achieve the same result or the same outcome, because there are no panaceas. Everything works, but everything works most effectively when it's applied to a specific set of circumstances for which it's most indicated. Now, there are a number of other caveats that apply and help to refine the understanding and refine the process of identifying the cause. Things like, well, when all you have is a hammer, everything looks like a nail, meaning that even though an individual, myself included, had chosen to acquire more education, more credentials, more experience, I was still acquiring experience within a very specific and well-outlined structure. simply translates as, now I was looking at what you were experiencing through the eyes of blah, 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 such and such and such. The credentials behind my name provided no ultimate substance in terms of really determining what was causing the symptoms that an individual was experiencing. And so onward through the additional caveats and ultimately into a process that looked at what is it that we all have in common. This eventually led me to the concept of the three realms, as I call them. And these three realms are simply distinct areas of influence that we are all exposed to during the course of our life in the bodies that we have on this planet Earth. And those three realms are structure, biochemistry, and what I call the virtual or the unseen realm, which consists of things like I call them the psycho-emotional spiritual influences, but they also contain emotions and feelings and thoughts and acquired behaviors that ultimately translated into a sentence that says, you and I are the biological end product of our interpretation of our perceptions. So what is it we were perceiving? How were we interpreting it? And then I began to be flooded with other thoughts that were associated with this that simply helped to refine, not necessarily explain, but refine my perspective in the sense that what you focus on expands. Attention goes where attention goes. Energy flows where attention goes. Attention goes where energy flows. All the same concept. And then when you change the way you look at things, the things you look at change. And so being aware of these simple concepts, I was able to differentiate what role each one of the influences, the structure, the biochemistry, and the virtual realm were playing in the compromises that ultimately resulted in symptoms. And then I realized that it wasn't purely a structure, a biochemical, or a psychological and emotional problem. Yes, it's possible for the cause of the symptoms to be rooted in one or possibly more realms, but there was always a predominant realm of influence. So the structure obviously contains elements of body mass, weight, structural integrity, responding to things like exercise, lifestyle, sleep, nutrition, diet, breathing. The biochemistry is more of a transitional world between structure and the virtual realm, in that if we are in fact a biological end product of our interpretation of our perceptions and we adopt certain beliefs and behaviors based on those perceptive interpretations, then in fact the biochemistry that we're looking at, particularly as part of the matrix assessment profile, is going to reflect that. And ultimately, it's going to express itself as symptoms, either in the structure or in the biochemistry. So then, how do we evaluate this elusive realm of psychological, emotional, and spiritual influences? Because there's so much more contained in this realm. There's developmental trauma, there's shock trauma. There are things that occur inside the womb. There are things that occur at different stages of the development process in terms of once you've emerged from the womb and you begin to progress through the development process as a human being from ages 1 to 3, 1 to 6, 6 to 12, 12 to 17 or 18, 18 to 21 or 25, and then beyond 25, there's certain consistent things that begin to occur. How do we take into consideration all of these possibilities? In order to do that, it is necessary, like Hippocrates said, to evaluate the whole person. Take all of these possibilities into consideration as part of the evaluation process, which is now what the matrix assessment profile is. So given a comprehensive history, given the most imposing symptoms that an individual is experiencing, given what they share with me in a one-to-one consult, and given what we see in the biochemistry as part of the quantum fluid analysis, we're able to begin to refine our opinions, refine the strategies, refine the appropriate intervention to a point where we can closely begin to address the actual cause of the symptoms. Now, let me give you a simple example. One of the very common and conventional diagnoses is that of osteoporosis. It's been assigned to a certain sex. It's been assigned to become more predominant at certain ages, and it's become assigned to certain specific activities or lack of activities, to certain dietary strategies, etc. But are these things related to the cause? In some sense, yes, they are. Is osteoporosis an actual diagnosis that can be treated with pharmaceuticals that are designed to enhance the appearance of the bone becoming thicker? Or is the appearance of the bones becoming thicker simply an illusion? Well, in many cases, the standard of care is to introduce something that slows down the rate at which the dead bone cells are eliminated from the bone, allowing them to appear thicker on radiological studies, but in reality, they're actually more brittle. They're more susceptible to trauma. And in reality, there is no substantial new bone growth. So why does the diagnosis, why does the symptom of osteoporosis begin to develop? Why does it exist? Well, one of the possibilities in my experience is that when there's an excess accumulation of acidic, toxic, corrosive waste product in the biological environment, I call it the biological matrix, which is simply a delivery system for nutrients into the cell and waste product out. Anything in excess that can't be eliminated or neutralized has to be stored in the biological environment, and it's very obvious upon fluid analysis that this is what is occurring. And is it the ultimate cause? We don't know until we begin to investigate and begin to address and begin to eliminate that toxic accumulation, and eliminate it through the other things that are inevitably involved and will show up on the matrix assessment profile. Liver compromises, kidney compromises, adrenal compromises from the biological stress. The biological stress then creating a secondary stress in terms of stress hormones being created and perpetuated over an extended period of time that then divert blood away from digestion. And so digestive symptoms may or may not begin to develop at the same time. So what if there is simply an impairment in sufficient quantities of the right raw materials in the biological environment that are now being consumed by the body in an attempt to neutralize this excess of acidic, corrosive, toxic waste products in the biological environment, and subsequently, in order to access additional nutrients required for other functions, the body simply begins to rob calcium and phosphorus from the bone, resulting in a symptom that we know as osteoporosis. That's one possible event that can occur, and it's one possible way that that event can occur. And so subsequently, I began to see all diagnoses as symptoms: cardiovascular disease, hypertension, diabetes, digestive disorders, regardless of the nature of the diagnosis, whether it was SIBO, IBS, H. pylori, and then a wide variety of things that can occur as a consequence of the microbiome being compromised, and all of the contemporary experiences ascribed to a disruption in the microbiome. Were all of these things an effect of, or were they a cause? Well, one of the caveats is everything is what it isn't. Simply meaning, in layman's terms, one man's ceiling is another man's floor, but in terms of conventional healthcare analysis, what it means is that a cause may not in fact be a cause. It may be a symptom, and that symptom may in fact lead us to a potential solution if we're willing to look at things nobody else is looking at in ways that nobody else is looking at them, which is part of the foundation for this entire analysis. And so to take it a step further, we're becoming aware now of things like the influence of genes, which we thought for a long time were able to consciously and deliberately make a decision as to whether or not they were going to impact our lives and our livelihood, when in fact, as a result of the Human Genome Project, which essentially provided the foundation for epigenetics to emerge, but in reality dictated the fact that the genes aren't that intelligent. They're not really determining whether or not you're going to experience something as a result of the mutation that occurs in the evolution of the genes, but these genes are in fact subject in terms of their ability to become active and express the mutation associated with them. They are subject to the environment. Now, this environment is composed, even though we're looking at the biological end product, the things that contribute to and cause the corruption, the compromises, the dysfunction in that environment can be associated with structural compromises, biochemical compromises, and psychological, emotional, and spiritual compromises. Now, each of these realms, and definitely the interaction between and among the realms, requires a specific and a very well structured intervention. But one of the other caveats is when you hear horses, or when you hear hoofbeats rather, look for horses, which means start where you are, which every specialty in fact does. However, the flaw in that thinking is that rarely do we take the time or the effort to go beyond that standard of care thinking. When you hear hoofbeats, look for horses, great start, great foundation. So you're an orthopedic surgeon, you're a chiropractor, you're an acupuncturist, you're a massage therapist. So you're looking at what it is you were trained to look at, but what if there's no viable or substantial response to your intervention? What do you do then? Well, you refer to somebody else in another specialty, and all of a sudden, they've heard hoofbeats. Now they're looking for horses, but what if something exists beyond the realm of that standard of care observation, perception, interpretation that is in fact much closer to the cause? Well, this is inevitably and unfortunately very true in many, if not most cases. We're very complicated beings. We don't have we're not one-trick ponies. It isn't just a cause for a symptom. It's not that simple. There are no panaceas. And so we have to be creative in our evaluation approach. We have to be creative in our intervention approach. And we have to be certain that we are introducing the right thing in the right order at the right time. So even if you've identified an associated imbalance, a compromise, a deficiency in a particular realm, it doesn't necessarily mean that that particular identification is at cause. It may in fact be an effect. Everything is what it isn't. And so as you peel back the layers of the onion, as you pull back the curtain on the possibilities, inevitably what you're going to see is a whole sequence of events, which is why the matrix assessment profile is a process. It's not an event. It isn't come into the office, run some blood work and some urine, do a physical exam, make a decision, write you a prescription, and solution in place, problem solved. No. In order to turn symptoms into solution, you must become proactive in your own healthcare strategies. You must start to ask questions. You must involve yourself in the process and begin to separate yourself from the, well, I'm going on the internet, I'm going to put in the symptoms that I'm experiencing, I'm going to take the advice at face value, I'm going to introduce this supplement, this strategy, this tool, this technique, or this mechanism. And so many people have gotten so many results that I too am intending to experience the same outcome. But unfortunately, in most cases, that's not going to happen. So as we progress through the evaluation process, there is a concept also called vicious cycle disorders, meaning that over a period of time, as these compromises, these imbalances, these deficiencies develop, they begin to draw from other realms in terms of support, in terms of engagement, and in terms of integrating influences from each of these realms. And then we begin to express low-grade multiple symptoms in multiple realms, and therein becomes the challenge. And so once again, back to the caveat, when you hear hoofbeats, look for horses. And so start where you are. Use the matrix assessment profile as a starting point. Deal with the obvious. Introduce a protocol specific not to the symptoms, but to what it is that you're seeing, hearing, feeling, and experiencing as part of the evaluation process. Now, once again, all of this is available on mymatrixmap.com, all lowercase, all one word, mymatrixmap.com. All of this is contained in my book, Beyond Medicine, Exploring a New Way of Thinking. And all of this is available to you by visiting the site at this point. We've put together a special package just for the attendees in this first of a series of videos, Exploring a New Way of Thinking Beyond Medicine. So in having said everything that I've said today, there's so much more to say. And in the during the course of the next several videos, I'm going to take you further and further beyond medicine as we explore a new way of thinking. I show you how this evaluation process works. I show you how to apply the results of the evaluation, and I begin to share with you the understanding that I've acquired over the past 40 years. So if you are so inclined, please take the time to visit mymatrixmap.com. Ask your questions, expect some kind of response from me, either in the form of an email or as a response on the next series of videos, depending upon what the nature of your inquiry was. Or you can submit an email directly to me at drd.matrix@gmail.com. So until next time, I'm Dr. Richard DiCenso. I can't thank you enough for participating in this video, and I look forward to seeing you here again in just 2 weeks. Thank you for watching.